For a year-long investigation into the Oregon Department of Corrections Health Services Division comes to an end today. An outside firm conducted the detailed review of the DOC to get to the bottom of healthcare negligence allegations at state prisons. In February, following a prison provider blowing the whistle on healthcare practices within Oregon prisons, the Oregon Department of Corrections announced an effort to reform its health services division. It hired outside consulting firm Falcon to go through its practices with a fine-tooth comb. 80 workshops, a staff survey, and site visits by Falcon found the largest area for reform to be access to off-site specialty care for inmates, for which Falcon recommended an overhaul of the therapeutic levels of care system, or TLC. What were the main reasons that there were those delays in care and people being or waiting long periods of time to get their prescriptions refilled?
It took too long to get to the therapeutic levels of care committee, the TLC committee that approves all of those consults. There were reasons people were coming through that TLC for approval that didn't necessarily require that level of approval. The TLCs were being held inconsistently. And then we had case management issues. Lastly, transportation issues.
Falcon says improvements need to be made to the scheduling process to remove those delays in accessing care. Over the last year, we've investigated accusations of negligence by the division reported by inmates and their families. In June of 2024, an inmate's death first brought health concerns among inmates to a head as several inmates reached out to us to report instances of alleged intimidation, weeks-long delays on medication, and medical request forms being left unanswered. Then in November, we spoke with a former inmate about his sex abuse lawsuit against the DOC, claiming while an inmate at Deer Ridge Correctional Institution in Madras, a doctor sexually abused him during appointments. The DOC removed its health services assistant director and its chief of medicine, who were also named in that lawsuit. The DOC says it's been focused on hiring for critical positions and pushing through the final stages of electronic health records implementation, doing away with the risk of paper records. With the help of state funding, the DOC says it's making changes and developing a continuous quality improvement office for health services to ensure the compliance with medical standards.
Moving transport officers, hiring additional schedulers, just creating changes in our process. The governor's office realized that we were in need of additional resources, and they gave those to us.
Falcon's report also noted burnout and compassion fatigue as issues among staff. The DOC will take the next 120 days to review the report and decide which recommendations will move forward. It will then create an implementation plan based on Falcon's recommendations. The full report is available on our website.